I think, that works with DARPA thinks the program managers are crazy to some extent. You're expected to be off the wall.
Yeah.
You're expected to push the envelope beyond where it could be. And people said, well, that's out of the box thinking. And I used to tell them, we don't even believe there is a box. And so, how far can you push it?
Yeah.
And, we knew that butyrate was an end product of fat metabolism. That's where it enters the Krebs cycle. So it was a rational and a logical place to look.
Welcome to this week's episode of the Human Enhancement Podcast. This is your host, Jeffrey Wu. And I'm really, really, really excited to have Dr. Joseph Bielitzki come into our program today. And this is an especially special guest because he is very much integral to the ketone ester story and the human ketone story. So by background, Joe was a program manager at DARPA, Defense Advanced Research Projects Agency, that actually kicked off the whole metabolic dominance ketone ester research. So welcome to the program, Joe. It's great to have some of the original characters back into the story here.
Thanks. It's good to be here.
So the history is not well understood or told. So I'm real excited to start teasing into the history here and make sure it's captured in the history book. So can you describe your experience? And I know you were the chief veterinarian officer for NASA. How did you end up at DARPA, and how did metabolic performance come into the picture? This is, early 2000, 2001, this is, almost 20 years ago.
That's a good question, how I ended up at DARPA. Most of the program managers are brought in by invitation for a 2 to 4 year period. Some of them may stay 6, but pretty much you're brought in for new ideas, and then you're let go because you've run out of them. I don't know if that sounds right, but it's pretty much the way it works. And I was at NASA. I participated in several studies looking at infectious diseases, and apparently I got somebody's attention because I got a call one day that said, how'd you like to come to DC and talk to us about maybe coming to DARPA on a temporary basis? So I did, and it seemed to have worked out pretty well.
What was your academic background? So it was interesting because I know a lot of the veterinarians I talked to end up being more broad than human doctors, just because you have to get so deep across so many different physiologies and animals. I'm curious, even before, NASA and DARPA, how did you get into, veterinarian medicine?
Well, I started out working in a zoo.
Okay.
And after a couple of years, I took a position at the University of Washington Primate Center out in Seattle. And I spent some time out there, some time at the Yerkes Primate Center at Emory University. And then I went to NASA. And so I spent really about 20 years in biomedical research, working across all areas of science. And you can't help but work with smart people and not pick up a little something in their field.
Yeah.
So over time, I just kind of I know a little about a lot of different things, but not a lot about one particular thing.
So and eventually became the chief veterinarian officer for NASA. So right. I guess how many veterinarians? I mean, I guess that's not surprising, actually, if you think about the first astronauts were dogs and monkeys. I mean, the cosmology program in the Soviet Union. So I imagine there's a bunch of animal work there. Yeah,
there it kind of goes up and down as far as frequency. NASA typically employs, there's 4 or 5 veterinarians that NASA has. There's one astronaut who is a veterinarian who's in the Professional Astronaut Corps, Rick Linehan. And he was instrumental in convincing me I wanted to work with NASA, and it's been a great time. I've gotten to do a lot of strange and different things, working with our Russian colleagues, with our Japanese colleagues, our European colleagues. So kind of all, and again, across all areas of science. When you're the veterinarian, you get the studies that they're doing. You don't get to pick which ones you work on, but your job is to make sure they go as well and as smoothly as possible.
Right. So you pull together this broad background of experience through NASA, and you got the call from DARPA. So folks that aren't aware of DARPA, it's sort of the sci-fi R&D center for the U.S. military. And you got the call, you headed over to DC, and what happens?
Well, DARPA's a little bit different because they don't tell you what you have to work on. Your job is to also determine what you want to work on.
Huh.
It
Okay.
has to have military relevance. It has to be forward thinking. It can't be incremental. It has to be more revolutionary than evolutionary. So I kind of always have had an interest in endurance sports and what you need to do to complete an Ironman or a half Ironman in some kind of decent physical shape. And
Interesting.
so when I got to DARPA, we were involved in Iraq and Afghanistan.
So this is around 2001, 2005.
Yeah, this was right after 9/11.
Okay.
And so one of the issues was, how do you provide support to the warfighter, to the young men and women who are going out to the field of combat in these places that really are pretty hostile environments when you think about working at 120 degrees, carrying 90 pounds, wearing body armor and all the protective clothing and the material equipment that you've got to carry. And so one of the questions was, if we're going to put them in that condition, how do we make sure they have adequate calories that they can do their task, not become fatigued, and not set them up to fail at a time when it's critical for their life? And so really it came out of that kind of mindset, a combination of a triathlon endurance sports background and saying, what does the warfighter need when they're going into the field of combat, and how do you give them the best energy support you can?
Right.
Or transition the kid who gets drafted from being an 18, 19-year-old who's been playing video games at a couch potato over a 12-week period into someone who's physically fit. And part of the goal was to see if we could get a 20% improvement in strength and endurance in 12 weeks.
Right.
So, those were pretty unreasonable requirements at the time we proposed them. But most of everything we did seems to have worked out. It does take some time from a concept to a product, though.
Right. I mean, we can talk about that full transition. I mean, this was conceptualized, as you're saying, in 2001, 2005, your tenure at DARPA. And now in 2018, the DARPA program that you initiated became a commercial product for the first time. And that's literally almost 20 years of progress.
It's probably about the length of time it takes for new ideas to actually, one, get the basic research established,
Right.
And there's been a lot of steps along the way, from synthetic process, safety, efficacy, testing, and then, getting through kind of an imaginary barrier of what the public and the consumer is willing to accept and thinks they want or need.
Right.
And then getting a product out there that, keeps everybody happy,
Right.
that has a marketplace.
Yeah.
You can't sell something if it's going to lose money on a continuous basis. So it's, there's a lot of barriers to getting a product from a scientific concept into a commercial market.
Absolutely. I mean, let's dive into it. Before talking about it, I want to actually talk about your endurance, your hobby there. I mean, it sounded like you were. I mean, what were you competitive? Were you? What times were you throwing up?
Just enjoyed it. Good friends. It was good to be embarrassed every week with my friends and colleagues that raced with me. I usually finished in the top third, but it never got past that.
Okay.
And but you do learn a little bit about how to manage energy during a long race. You pretty much knew in a half Ironman, mile 30 to 35, you're going to be going, why am I out here doing this? Which is usually the first sign that you're hypoglycemic.
Right.
And, and then you're trying to fake it for the next, 25 miles on the bike and next 13 miles on the run. How do I get calories into my body?
Right.
So I can continue at a pace that's reasonable and not be totally embarrassed.
Yeah, and then a lot of our discussion with professional triathletes, they often say that, the triathlon is swim, cycle, run, and the fourth sport of triathlons is nutrition. How do you feel yourself over, that 5 hours you're doing that half Ironman, or that 10 hours you're doing that full Ironman? Nutrition is an art and a science and a competition in of itself.
Well, you just talk to people who are just starting and tell them that, everybody tries to figure out how they can eat through this process. And you have to eat because you can't get the carbs otherwise.
Right.
But also learning to run on empty, always being a little hypoglycemic or a little bit below optimal, because your metabolism will adjust to that.
Right.
And, I always tell people that I knew I had enough energy in my stored energy in my body for a couple of weeks. I just couldn't get to it.
Right.
And so the question was, how do you go ahead and make that transition from carbohydrate metabolism to stored energy and fats?
Which is an interesting segue into the conception of the ketone ester, right? So for, again, to review the physiology here, when you're talking about reducing glycogen reserves or going hypoglycemic, our bodies only store a limited amount of glucose or sugar or carbohydrate, around 2,000 or so calories. And that will fuel you for a little bit, but in a 3-4 hour run or cycle, you're draining through all of that. So that's why I would say like the old school approach to solve that problem is the carb load, right? We've all heard of the discussion, eat a ton of pasta before your marathon or slam all these sugar bombs and glucose drinks as you're racing. So that must have been in your head as you're conceptualizing the DARPA program. So it's like, okay.
You can only eat so much pasta the night before,
right?
Because you can only saturate your glycogen stores so much.
Right.
And then after that, when they're depleted, it's got to come from someplace else.
Right.
And, we metabolize glucose and fructose pretty quickly when it's taken orally. And, you kind of ride the roller coaster up and down.
Which enters into the world of ketones and ketosis and fat metabolism. I think when perhaps the layman thinks about, X-Men and super soldier serums, they're thinking, crazy pharmaceutical compounds. And I thought it was really interesting that, you guys were not pursuing an investigative new drug, or, the drug route. You guys are not, going down the supplement pathway. This is nutritional food. This is a food substance with caloric, with caloric value, and it really looks like a fourth macronutrient, and that must have confused people. I mean, even with our label today, the 3 macronutrients, as people commonly look at them, fats, carbs, proteins, there's none of it in the ketone ester, but there's still caloric value. And most people are like, how is that even, that I don't understand. I mean, I can imagine, 20 years ago, people were like, is this real? What was the perception? What was the thought? Did people thought you were crazy? How was the skepticism?
Everybody, I think, that works with DARPA thinks the program managers are crazy to some extent. You're expected to be off the wall.
Yeah.
You're expected to push the envelope beyond where it could be. And, people say, well, that's out of the box thinking. And I used to tell them, we don't even believe there is a box. And so, how far can you push it?
Yeah.
And, we knew that butyrate was an end product of fat metabolism. That's where it enters the Krebs cycle. So it was a rational and a logical place to look. Anything before that, was going to take some other enzyme systems and some breakdown mechanisms to get it to enter the energy cycle. The nice thing about butyrate, when you look at it compared to pyruvate, that they're really pretty close as far as energy production.
Right.
And, the Gibbs free energy is, it's closer than most compounds that are in the energy cycle. And so, we didn't know it would work. We didn't know we could do it when we started. And that's the nice thing about DARPA. They ask you to do things that nobody has done before.
Right.
And so it gives you a shot to be a little bit crazy.
And I think it's also a good engineering, just ruling out possibilities, right? If, as you mentioned, there's just a limited number of pathways that activate the Krebs cycle, the citric acid cycle. And it's just like, okay, if pyruvate or glycolysis has one pathway and that's well understood, people are already carb loading, can we load the other side without just eating fat? And that's like not good enough. You can't eat fat directly. Can we hack or come up with new compounds that can enter the butyrate pathway or that pathway, which I think is it sounds like almost obvious or elegant in retrospect, right? It's like, okay, we know this one pathway, we've tapped that out. Where else can we look? Well, it's got to be the other possible pathway, and then what can we do there?
It only looks elegant when it works. And if it not worked, it wouldn't have been so elegant. But I mean, it was the thought process that went behind it, was looking at, the metabolic pathways chart and saying, okay, where can we play?
Yeah.
And there really aren't very many places. From protein breakdown, you go through gluconeogenesis,
right?
But then you still enter through pyruvate with that. And so this is really the only other energy point that you can enter the Krebs cycle with an exogenous product. And so it was kind of focused on, where can we actually do this? What's the inflection point?
Right.
And we really wanted to get away from, insulin cycling. That this is not an insulin dependent factor, and it's a cycle that goes up and down, and you've got peaks and valleys. With butyrate, it kind of flatlines the energy availability, so you don't have to worry about that quite as much. And so if you can keep the circulating levels up, you've got adequate energy, and brain and muscle don't really object to living off butyrate.
Yep. I think that's a subtle physiology that people don't understand, and I think will become well understood in the near future, hopefully, that, when people are slamming these glucose drinks and glucose shots, they're very aggressively spiking insulin and crashing insulin, spiking insulin and crashing insulin. And a lot of these like endurance athletes end up having pre-diabetic looking biomarkers with higher resting levels of insulin, higher H1BACs. I think and I think that's why you see ketogenic diets, exogenous ketones getting more and more interest. Can you have an insulin, a non-insulinogenic or insulin dependent, if you will, substrate that's a very efficient fuel for the body and brain?
And this doesn't play with any of those pathways associated with either type 1 or type 2 diabetes. So, it's like it's separate from that. And so, is it more efficient? Time will tell. Right. But right now it looks like it's effective, which is, first step is demonstrating efficacy. And I think that's happening. And we're confident from a theoretical point of view that it would happen. And it really has taken 15 years to get here.
Yeah.
Over repeated testing, it's proving that this isn't a good way to give energy to in a non-carbohydrate based manner.
Right. So, you're over at DARPA, and some of the other key collaborators that you pulled together include Professor Karen Clark over at University of Oxford and Dr. Richard Veach at the National Institutes of Health. So how did all these characters come together under your aegis over at DARPA? From my understanding, every RFP has multiple bidders, multiple potential, pathways of execution, and the Veach Clark path ended up panning out. Can you describe that story and how that all came together?
DARPA doesn't write an RFP. They actually write something called a broad agency announcement.
Okay.
And so an RFP will ask people what area they want to work in. Mm-hmm. And a broad agency announcement gives them a target that says we want to create a ketogenic diet.
Okay.
And both Kieran and Bud Richard, whichever name he's going by now, I know him by Bud, both of them had interest in the applications of butyrate to certain clinical problems that were basically defects in carbohydrate metabolism. And both of them have pedigrees in metabolic physiology that you're not going to replicate very many places.
Right.
So, DARPA has a tendency to attract world-class researchers who can take a chance with their career. Taking 3 or 4 years off to try and create a butyrate-based diet and demonstrate its efficacy could be career-ending if it doesn't work for a young investigator. So you have a tendency to get young, crazy investigators who don't know the risk, or really old, established people who are willing to take the risk because they want to leave a legacy behind as far as what they do with something. So I think both Bud and Kieran fall in that category, but they self-assembled. They came forward with this concept and, said, we think we know how to do this and we think we know how to control the chemistry. And they demonstrated they could.
That must have been, for you as a program manager and seeing this, just a team that assembled to help create this vision, what was that like back in, I guess, 2003, I believe, was when the announcement came out and some of the initial responses came in. What was your thought process? Did you think that no one would respond? Were you thinking, this is a cool project, a lot of people will respond? I think that the name itself, I believe you called it Metabolic Dominance. It's such a cool code name or project name.
It did morph away from metabolic dominance to peak soldier performance because it needed more of a defense orientation, and it worked. It was the same program, just a different acronym. And so it worked out fine, but it was really all focused on mitochondrial function.
Right.
And, you typically will spend a year and a half trying to conceptualize the program. What are the elements that need to go into it? Who may be the key players, in this country or globally? And, you're looking for somebody who has confidence that they can pull something off. Because typically you're asking to do something that nobody has ever done before.
Right.
And so, when you do that, you don't get everybody coming out of the woods saying, I'm stupid enough to tell you I can do this when nobody's ever been able to before.
Right.
And confidence, have good scientific pedigree, and having a vision for how to pull it off.
Yeah. So I think some of the most interesting scientific results from the research were that the delta G, the Gibbs free energy of ketone metabolism was more efficient than glucose metabolism or even fat metabolism. I thought that was just so fundamental to life. I mean, it's literally the fundamental equation of life, right? Like, how much work can you done with a given amount of substrate? That was one of the most interesting results that that came from some of the work. I'm sure as you were monitoring and coordinating some of the work, there were ups and downs, surprises of results. I mean, what stuck out to you as some interesting results from the scientific side, from the product side, from the compound side? What were some of the surprises? What were some of the disappointments as you were working through the technology?
I think it's going to sound real funny, but a lot of the real frustrating parts had nothing to do with the science. They had more to do with the intellectual property and trying to sort out, what needed to be protected, how it needed to be protected so that this could actually become a product. Mm-hmm. And then I think overcoming the flavor and aroma issue with this and finding the right compound of all the potential possibilities you have when you talk about butyrate.
Right.
How do you minimize the negatives and optimize the positives? And they were able to work through a lot of that.
Right.
And then backing it up with studies in mice and rats that showed that they were able to actually, function at a low level of physical activity for periods that were significantly longer than mice on normal chow.
Yeah, was that surprising to you? I mean, I think just reading the published peer-reviewed results, I was like, wow, mice were literally solving mazes 38% faster than control. I mean, that's just like holy shit, like.
When you're the program manager, you expect the impossible to happen. So, after a while, you find that you work with so many really great scientists that do stuff that everybody says is impossible. You're not surprised when it works. You're already pre-focused that this is going to be successful because you've had to walk forward and get the funding to give to the investigator. And so, you go in with a degree of optimism that, the science that you've looked for and reassembling the pieces of the puzzle to form a different picture is possible. And then as the data started coming in, it became more and more obvious that this was not only possible if we could overcome, the palatability issues, that this was going to be a product that would be worthwhile.
Any scientific result surprise you, or were you just like, oh, of course, like I that's what I expect? I mean, none of the results surprised you?
Not really. I mean, once they got the synthetic pathway down,
right?
Because they had to come up with a totally new synthetic process. Once that happened, I think the physiology that I anticipated was there.
Okay.
And the results that they were getting was what, I had prayed for and hoped for all along. Right. And so I wasn't really surprised that they got the results, but it did make me smile a lot.
Yeah. I mean, I think for, someone that I guess doesn't have the theoretical background, I mean, some of the just end results are just ultra compelling, right? 40% reduction in lactic acid production. And for, if you're doing an Ironman, you are generating so much lactate, you're sore, you're that burn, and you're producing 40% less of that. I mean, that's an incredible number, right? You're increasing aerobic endurance performance. That's pretty phenomenal. I mean, not a lot of things improve human performance. Making rats smarter. I mean, like there's more, some data in the publication pipeline around that also reflecting in humans as well. These are pretty sci-fi results, and it's kind of funny to hear that you knew that was going to happen.
I think the other thing is that this was just 25% of the program, that this wasn't the only thing that we looked at.
Okay. Because
we looked at thermal control. By keeping you cooler, could you go longer? And the answer is you certainly can. We also looked at a number of polyphenols as far as the impact it had on mitochondrial function. And we knew that polyphenols are an important part of, oxidative protection against free radicals and oxidative damage, but we didn't know really how it would work with the mitochondria. And so, it was just looking, I hate to say this, looking at a lot of microbial physiology and looking at the mitochondria as a bacteria that let us ask some questions about, how would you put this together differently if you had to figure out how to make it work. So some of it was just looking at the science differently, but also getting people to come forward and telling you, I think this will contribute.
Right.
I think this could work. And then giving you good scientific evidence on why they're thinking contrary to the way everybody else was thinking was possible.
Right.
And butyrate fell into that category. I mean, I think a lot of people thought about it. The Atkins diet was emerging. You see South Beach diet was coming out. You see a lot of things happening, around this time frame. But there were more skeptics than there were supporters.
And I think the ketone, the role that beta-hydroxybutyrate played in Atkins or South Beach was relatively unknown. I mean, I think it was, focused more on the protein and reducing the carbs, but I think the implication of BHB itself was relatively, less known, right?
Well, they knew it was a ketogenic diet,
right?
But they hadn't really looked at the pathways. They hadn't really looked at what was going on with respect to fat metabolism, because it really was about suppressing carbohydrates.
Right.
The ketones was actually, you had to drink a lot of water to make sure that you were able to deal with the ketones that you were producing. But, it ended up being a little bit different than what everybody thought.
Yeah, right.
And that's the nice thing about it is over time, to some extent, we've rewritten some of the chapters in the physiology book.
Right.
And I think for me, that's one of the more fun things is that there is new science that comes out, and you have to be able to see it to take advantage of it.
Yep. And I think that's something that I think will be more and more well understood, that when you have a ketone ester on top of a fully carb replete human, you're in a novel state of physiology where you have dual fuel sources. I mean, that just doesn't occur in nature when you have full glycogen reserves and, fully topped up with ketones. So it is not a stretch of, it's not an exaggeration to say this is novel physiology. This is a new chapter in a physiology textbook.
No, but there's a lot of things that switch over to fat metabolism. Hibernating animals in torpor, they don't have enough carbs to live through that period. So I mean, there's a lot of changes that happen,
right.
And we have looked at hibernators as a basis for some of the metabolic things that happen in transitions to support that butyrate can be metabolized over long periods without harm.
But my understanding is that humans are the best animals at generating ketogenic, in the sense that a large part of that evolutionary function was that you needed fuel for the brain, and brain energy metabolism for the human is a lot greater than the requirements for a bear, for example. A bear doesn't need to have as much ketones to fuel the brain. Gluconeogenesis will provide enough glucose to fuel the brain over a long hibernation period, but it's not enough for humans, and therefore humans are one of the most ketotic animals.
Yeah, bears may have different cognitive capabilities, but their brain still needs, the same kind of metabolic support.
Right.
And so, actually, the black bear will probably be the model for, for people as far as some forms of energy metabolism. I think that the other thing is that this transition away from believing that the brain only lived on glucose, is going to upset a lot of people over time, because that was the dogma for a long, long time. And we're finding more and more that, butyrate is an adequate energy source for the brain, that neurons don't object, that mitochondria are perfectly happy taking producing ATP with butyrate as a major substrate. So things are changing as a result of this too.
Absolutely. We're in conversations with Professor Stephen Cunnane, who has a PET scanning method in terms of looking at ketone metabolism in the brain. And, there's more and more data suggesting that, ketones not just a source of metabolic substrate for the brain, but also preferred substrate for brain metabolism. I mean, it gets uptake first before glucose.
If you think about other non-human primates, they're kind of squat and gobble eaters.
Right.
A baboon will stuff his mouth as much as he can, then go off and digest what he's got stuffed in the cheek pouches. but they probably experience ketosis on a regular basis, because food may not be readily available. They may be, in a dry period of the year. So all those things kind of come into play in how you think about what humans are capable of too.
Right.
And from an evolutionary point of view, we probably weren't always intended to be fat and sassy. That we're probably, lean. We probably had a much higher daily energy requirement than we have now. And and that we probably experienced long periods of ketosis.
So I think that's a good point. In our natural, I guess, more primal states, we were clearly cycling in and out of ketosis. And just in our modern, obese, pre-diabetic society, I mean, most Americans are on the path of being overweight, obese, if not pre-diabetic and diabetic. That we're not. I mean, yeah, we're very much over on very much on the extreme side of energy consumption. But I'm actually curious to dive into some of the other candidate compounds. So you were mentioning that as you're identifying different butyrate compounds, obviously the one that we're commercializing is a D3 beta hydroxybutyrate butanediol monoester. But it's unlike, in the early planning and early research periods, there are a bunch of candidate compounds. What were some of the, challenges or surprises there? In my conversations with Professor Clark, for example, she mentions that, while the current ketone ester is still kind of crazy tasting, the other ones are just even crazier, just like completely horrible. I mean, did you have a chance to start playing with them yourself? I mean, what was your experience there?
We always let somebody else taste the bad stuff. No, I think that, I think, the folks at Oxford have played with the structure of the ester to some extent to minimize the flavor component of it, because there was no option. If it was going to be, it may be really good for you, but if nobody will eat it, it doesn't make any difference. And so I think that you could exclude a number of butyrate based compounds just because there was nothing you could do with them chemically, and there was nothing you could add that would mask it.
Right.
And so, it kind of became process of elimination.
Right.
And certainly the esters seem to be, superior to other compounds as far as flavor.
Right.
And this is, it's there's still some more tweaking that probably can be done, and we'll see where it's going to go. But I mean, I think right now, it's not bad.
Yeah.
It's not something I'd sit down with a big glass of, watch a late night movie. But on the other hand, for what it's intended to do, it's as an immediate energy source. It will work really well, I think.
Yeah. And we've gotten some feedback now, and it's quite palatable. I think most people have read like the horror stories on the internet around how this tastes like rocket fuel or jet fuel. And it's like not that bad anymore. Like there's a lot of work to get the purity up, and also the flavoring and productization work that our team has done. It's actually like not too crazy.
No, I think that's the direction it needed to go. That was always one of the rate limiting factors for this product was, how do you take control that really pungent odor and, kind of bitter taste that goes along with it. And I don't even know how to describe, it's something nobody should really want to experience, is the taste of this native compound alone.
Yeah, I mean, I guess my way to describe it is just nail polish remover, bitter, just almost, but it's maybe a hint of savoriness. I know, it's just like a very weird, taste that doesn't exist.
So, yeah, and I think and the other thing is, it's the early products had a different different viscosity. It kind of had greater mouthfeel,
right,
and seemed to cling to your tongue and teeth for extended periods, which didn't help.
Yeah.
But I think it's moving in the right direction.
Yeah. What are you excited about moving forward in the future? I mean, I know you hinted a little bit at the clinical applications. So the most robust published research relate to performance, especially endurance performance. I'm curious your thoughts in how this space unfolds. Can we see this as really a fourth macronutrient in the sense that every single human is going to have some ketones every single day? Is that in the cards? how do you think this ketone story unfolds?
Well, I think, Dr. Veach had, made an interesting observation. There's some people who don't tolerate carbs at all.
Right.
And so, they really need to be on a ketone-based diet. And, managing your diet exclusively through intake is difficult. So this gives them a kind of a little bit easier way to manage some of that.
Right.
And I don't think, there probably will be long-term applications as now that we know that the brain is happy metabolizing it. We know, for example, that Alzheimer's patients don't metabolize glucose as far as the brain as well as non-Alzheimer's patients. So whether it can improve cognitive function, you've got diabetic populations that, don't absorb glucose into the cells. Butyrate does get absorbed into those. So, I think it's just right now at the edge of, what its capabilities might be. It was never conceptualized originally to have clinical applications to other diseases, except for knowing Dr. Veach's interest in, this particular seizure disorder in kids with carbohydrate intolerance.
Right.
And so, we knew that early on. But again, that was kind of a pipe dream. If we could pull this off, could you actually impact that population?
Right.
And I think, people will be asking those questions.
Yeah.
We've never been able to manipulate energy metabolism because the only thing we've really ever had to put into the system was carbohydrates.
Right.
And, so this gives us a little bit different entry point. And, I think you have to wait and see how neurons and muscle are actually going to handle butyrate as far as an exogenous energy source.
Yeah, I think there's quite obviously we're standing on the shoulders of giants like yourself to get it to this point. But yeah, there's so much more work to be done. I mean, I think you put it absolutely right that initially as a performance technology, I mean, it makes sense. These are the most robust population. We can get more and more safety data and pharmacokinetic data there. And as that becomes more proven out, can we start attacking some of the most pernicious health problems? I think you were just referencing some of them: Alzheimer's, diabetes. If we can at some point make some impact there, that would be, just personally, just exciting for the world. I mean, not even just for ourselves as a small part of the story here.
So it's going to force people to look at metabolism differently and consider the options a little bit more. And I think you're looking at just a transition point right now. How people are looking at health too.
Yeah.
Greater consideration as to what goes in my body.
Yep.
And at least in certain percentage of the population. And so, being able to impact that, you see all kinds of changes going on with microbiome, with different diets, different energy sources, and discussions that happen across, across the health professions. And I'm not sure where it ends. But I think we're going to do better in the future than we have in the past. And I'd like to think that, if this opens any doors or makes anybody's life better, extends life or quality of life for people, make me smile, just for a long, long time. It's accidental consequences, collateral benefit rather than collateral damage.
Yeah. I want to almost leave it at that. I mean, I think the story around the ketone ester is, deserves to be told. And I think a large part of how this technology came to existence was under your aegis. So I hope, the story here doesn't end with, just our conversation, but more and more people realize that there's just so much work behind, what we at HVMN are practicing out there. It really came from, years of research, good work over at DARPA that, really dates back, 10, 15, 20 plus years of just physiology, metabolism, mitochondrial thinking to even get to a point to kick this thing off over at Veach and Clark, and then from here to hand it off to us to take to the world. So,
and you go look at Dr. Veach's publications, and you see a co-author named Krebs. He was a student. I mean, he has an incredible pedigree.
Yeah.
And incredible knowledge. Same with Dr. Clark. I mean, they just amaze me with their knowledge base and what their ability to conceptualize the science differently, and to set a goal and a target and to achieve it. Is really remarkable. Very few people have that privilege. Most people will get a publication out of it, and they've done something that actually can change healthcare and performance. So all I can say is thank you to them.
And no, thank you for taking the time, Joe. Appreciate it, and we'll talk soon.
Thanks, Jeff.
I've gotten to know Joe over the last few months as we're prioritizing and bringing the ketone ester to market. So it's really great to bring his story and his contribution to the work here to you guys. Again, I think there's so much history and work behind what we're doing at Human. So excited to showcase these stories and bring them to you guys. As always, appreciate your feedback and comments. As you know, we started a new email hotline, podcast@human.com. Both Zill, my producer, and I read every single email that you write to us on that hotline. And if you leave us a review, just take a screenshot on iTunes, hopefully 5 stars. But if we aren't up to snuff, rate us as we deserve. But if you give us a review, take a screenshot of that. Happy to send you a free Sprint Mini. Sprint is our acute nootropic for focus and energy. Leave a review, send a screenshot to podcast@human.com with your feedback, and Zill will send you a free Sprint Mini. Thanks so much, and see you next week. Bye.